Hi, today we will be talking about cervical radiculopathy. I know some of you are thinking, well, I know cervical means neck. Yes, you're absolutely right. Cervical means neck. But often, as an upper extremity surgeon, patients will come in to see me for arm pain, not realizing that the pain is actually coming from the neck. The presentation varies tremendously. Depends on where the nerve is being compressed in the neck. Patients often come to see me for arm pain, and then I'll ask them to move their neck, and they'll sometimes describe turning one way and having pain shooting down their arm. And this is called cervical radiculopathy, okay? And the location can actually change from time to time. They'll sometimes have pain in the forearm, and then sometimes there, sometimes on the back of their shoulder. All these things can vary. So that's, again, another clue that you may be having cervical radiculopathy. So the exam is pushing around the neck, range of motion, and provocative testing called Spurlings, where you have the patient extend their neck and rotate to one side. If they have pain that shoots down the arm, that's a positive sign of Spurlings. Imaging can often show abnormal straightening of the neck. So the neck normally has a gentle C curve. And you can also see arthritis in the neck, which is the loss of disc space, and bone spurs, which increase the risk of injuring the disc during trauma. MRI can also show bone spurs and disc protrusions that can irritate those nerves as they migrate out of the neck area. And then treatment is often with anti-inflammatories, therapy, chiropractic treatment, and epidural injection if conservative treatment fails. We sometimes will give a steroid pack to patients in the office in the setting of severe pain, especially if I'm concerned there could be significant nerve compression or permanent damage. And then early detection is important. So if you develop a stiff neck and painful neck and notice some arm pain that is worsened by rotating to one side or the other, my recommendation is to seek medical attention with your orthopedic surgeon, because this is the one condition that early detection and treatment can prevent permanent nerve damage that can occur with continuous compression of a nerve in the neck. So if there is a full tear, please seek medical attention immediately. All right, today we'll demonstrate cervical radiculopathy. Again, what I've mentioned is that cervical radiculopathy is pinching of the nerve in the neck. So what I'm looking for is signs that there's something going on in the neck that's causing patients to think that there's something wrong with their arm. So what I would do is I would do what's called a Spurlings test. A Spurlings test is where you ask the patient to extend their neck and then rotate to the side that they're having pain. And if I gently push down, they'll say, ouch, and then they'll describe to me that pain is radiating to that area where they're having that arm pain. So it could be up here in the arm, or it could be down there, or even going to the fingers if it's depending on where that nerve is being pinched. And throughout the neck, it could be C23, C45, C56, C67. So depending on where that nerve is being compressed, that's where you will, the patient will describe the pain when you do the Spurlings test. So that's essentially the cervical radiculopathy exam. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.